Natural family planning. Condoms. Condoms are usually made of latex rubber and are about 0.065 to 0.085 millimeters thick. Thinner condoms have been used for many years, and condoms as thin as also available nowadays. Polyurethane condoms are also available. Women whose partner uses a polyurethane condom should check with a healthcare provider to be sure it provides protection against STDs and HIV. An important advantage of latex condoms is that they prevent the transmission of HIV and STDs. Condoms also offer protection from cervical dysplasia. Important points about condom. Condoms should be purchased in a store where the customer is guaranteed product reliability and freshness. Heat, pressure, and age can lead to the degradation and ineffectiveness. Condoms should not be used more than 5 years after the manufacture date. If the condom looks deteriorated, is discolored, or feels sticky or brittle, it should not be used. Likewise, if the package is torn or damaged, the condom's inside should not be used. Petroleum or oil-based lubricants can degrade latex and should be avoided. Care should be taken. Condoms are easily torn, so care should be taken while putting them on and taking them off. Researchers estimate that condoms break once out of every 115 to 477 acts of intercourse. Tearing usually occurs before ejaculation and is probably caused by too much friction, which can be reduced by the use of lubricants. The failure rate is about 10 to 14%. The female condom, diaphragm. The female condom consists of a polyurethane sheath attached to a ring of latex that covers the entire vulva as well as the vagina. Because the sheath is not made of latex, it can be used with a water-based or oil-based lubricant. It has proven effective at preventing the transmission of HIV, though the NIH warns that these condoms are not as well studied as latex condoms. Theoretically, female condoms offer increased protection from STDs as well. It is not yet clear how they affect sensation or how acceptable they will become as a useful method of contraception. Vaginal spermicides. A spermicide is a chemical that kills sperm. Vaginal spermicides are made of a spermicide mixed with a cream, jelly, or foam base. Some spermicides are sold as vaginal suppositories, which are solid at room temperature but melt to liquid at body temperature. Spermicides are not very reliable when used alone, only about 70 to 80% effective. They are designed to be used in combination with a condom, diaphragm, or cervical cap. About diaphragm. A diaphragm is a circular, rubber cap-like shield that is put inside the vagina before intercourse to cover the cervix. It is made of a metal spring that is covered with latex. Diaphragms come in several different sizes, from 50 to 90 millimeters in diameter, and types, coil, flat, or arcing, depending on the rim of the spring. It is essential that diaphragms be fitted properly, because an incorrect fit can cause discomfort and vaginal ulceration, sores. It is also important that women insert it correctly, so it covers the cervix and upper vagina. How to use diaphragm. Diaphragms are always used with spermicides, although it is not at all clear how much extra protection the spermicide provides. The diaphragm can be inserted several hours before intercourse. The diaphragm should not be removed if intercourse is repeated. Simply add more spermicide. It should be left in place for at least 6 hours after sex to provide complete immobilization of the sperm. After the diaphragm is removed, it should be washed with soap and water, allowed to dry, and stored away from heat. Diaphragms should not be dusted with talc because it has been linked to ovarian cancer. Disadvantages include an increased risk for bladder infection and cystitis. Cervical cap. A cervical cap is smaller and tighter fitting than a diaphragm, covering only the cervix. It is harder to fit and takes longer to learn how to use. It can be left in place for up to 72 hours. Cervical caps are inserted by compressing them between the finger and thumb and placing them through the vagina, dome outward. The cap should be pushed gently up to the cervix and into place. The dome should stay compressed for a few seconds, indicating a gentle fit. The cap should be used with a spermicide and checked to make sure that it has not been dislodged during intercourse. Use of a cervical cap has been linked to toxic shock syndrome, but the risk for cystitis, inflamed urinary bladder, are lower than with a diaphragm. Its failure rate is about 8%. Intrauterine devices, and it is a small piece of metal or plastic that is inserted by a physician through the cervical canal into the uterus. A string remains in the vagina so the woman can make sure the IUD is in place and to allow for easier removal by a physician. IUDs do not protect against HIV or prevent the transmission of STDs. It is not exactly clear how IUDs interfere with conception. It is generally believed that IUDs interfere with the passage of sperm through the uterus, thus preventing fertilization. IUDs, which are smaller, more comfortable, and provide better protection against pregnancy. The Copper T. Copper T is FDA approved for up to 10 years of continuous use during all stages of reproductive life. This contraceptive device is associated with a pregnancy rate of less than 1%. The most common side effects of Copper T are pelvic inflammatory disease, PID, ectopic pregnancy, pregnancy that occurs outside the uterus, heavy menstruation, irregular menstrual bleeding, and pelvic pain. Thanks for watching this video. Please like, share, and subscribe channel for more sex tips. Have a nice day.